Salim Rezai here, and I want to talk about racial discrepancy in medical equipment. And there's specifically two devices that I want to talk about. This is going to be pulse oximeters and the forehead thermometers. So the first paper was published in New England Journal of Medicine 2020, right when we were in the middle of the COVID-19 pandemic. And what they did is they compared the pulse oximetry reading to ABGs in white patients and African American patients. And here's what they found. Across the board, regardless of what oxygen pulse oximetry reading you were getting, in African Americans, it always read 2% higher across the board. And what was even more disturbing is there was approximately 3% of patients of color that had more occult hypoxemia. So the bottom line here is that pulse oximetry may actually be less reliable in people of color by overestimating oxygen saturation. Now, this may not matter at higher oxygen saturations, but you can imagine when we were in the beginning of the pandemic and we had people that had oxygen readings of 90%, 91%. Now, in African Americans, this might actually be 2% lower. And so we might want to be a little bit more conservative with these patients. The second device is a paper that just came out. This was a letter in JAMA of this year, 2022. And this was a retrospective analysis looking at the temporal thermometers, the ones that we kind of hold the little guns, compared to oral thermometers. And here's what they found, that in African Americans, the prevalence of fever with a temporal temperature thermometer was 10.1%, but with an oral, it was 13.2%. This discrepancy was not seen in Caucasian patients. And so therefore, we would be underestimating the number of patients that have fever. So clinical bottom line, temporal thermometers in dark-skinned ethnicities in combination with fever cutoffs will lead to fever going undetected in many of these patients, which then is delaying antibiotics, delaying hospitalization, delaying treatment, and you can see how this can extrapolate to worsen clinical outcomes. I want to leave you with one final thought. Equipment that we use in healthcare gives us objective information, and this information is what drives medical decisions and how we treat patients. Many of these tools were not developed or validated in racially diverse groups of patients, and we need to pay attention to this stuff because I'm not talking about equity in healthcare. I'm not talking about racism. I'm simply talking about making medical decisions, and these impact the decisions that we make. And so these are just two pieces of equipment. Who knows what other equipment has this kind of issue with it? Leave me your thoughts, comments, and questions. Thanks for tuning in, and until next time.